Hello, everyone, and welcome to today's presentation. We are going to be discussing the 2024 rules for physical and occupational therapy assistance in Medicare. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance education and consulting firm specializing in physical, occupational, and speech therapy practices. We offer monthly live, full-length continuing education courses, guides and sample forms on Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy compliance or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. A few important notes. PTAs and OTAs do not enroll in Medicare, but instead bill under their respective supervisor's NPI number. PTAs must be supervised by a PT, and OTAs must be supervised by an OT. Assistants cannot treat incident to or be supervised by a physician or NPP, and speech pathology assistants cannot treat Medicare patients. Normally, Medicare requires a therapist to be on-site when assistants are treating patients. However, they are not required to be in the same room. During the COVID-19 emergency, Medicare made a temporary change that allowed therapists to remotely supervise assistants via two-way real-time audio-video technology. For now, this policy will continue until the end of 2024. The temporary rule allows direct supervision through virtual presence using audio-video real-time communications technology. The supervising therapist must immediately be available to engage with the assistant via audio and video technology. Being available by phone is not enough, though this does not require real-time presence or observation of the service through interactive audio and video technology throughout the performance of the procedure. For remote monitoring services, CMS will continue to allow for general supervision of assistants. General supervision means the therapist can be off-site but available by telephone. The supervision rules in facilities have remained the same. Therapists can be off-site, but periodic visits are required, for example, every 30 days for patients in outpatient rehabilitation facilities, CQ and CO modifiers. Remember that the CQ is used for PTAs and CO is used for OTAs. GP and GO modifiers are still required. The 15% payment reduction for assistant services that started in 2022 is still in effect. The cut does not apply to the 20% patient coinsurance portion, so the net cut is 12%. The modifiers are always required when the PTA or OTA furnishes all of the minutes of a service independent of the respective PT or OT. The modifiers are also required when the PTA or OTA furnishes a portion of a service or unit of service separately from the part that is furnished by the PT or OT. The minutes for that portion of a service or unit of a service furnished by the PTA or OTA exceed 10% of the total minutes for that service or for a specific unit of a service. The modifiers are not required when the therapist provides services for the entire time or when the therapist is involved for the entire duration of the service and the assistant provides therapy alongside the therapist. For our first example, the assistant provides 10 minutes of therapeutic exercise and the therapist provides an additional 5 minutes. The total is 15 minutes or one unit. In this case, you would apply the CQ modifier because the PTA provided at least 10% of the total time. This is called the de minimis standard. In the second example, the therapist spends more time with the patient than the assistant, but because the assistant spent at least 10% of the total time, the CQ modifier is applied. The de minimis standard is a very low bar. If 10 minutes are spent with the patient, the assistant only needs to be alone with the patient for 1 minute for the modifier to be required. This is looked at on a unit-by-unit basis, as you will see with the next examples. For the third example, the therapist provides 30 minutes of therapeutic exercise to the patient, and the assistant provides an additional 5 minutes. Here you can build 2 units without the CO modifier because the therapist provided enough time with the patient alone. The extra 5 minutes must be recorded in the documentation but is not billable. In cases where there is an additional unit that can be billed because of the total time rule. The additional unit can be billed without the modifier if the therapist provides at least half the time for the extra unit. If the extra unit is from the assistant's time, then the modifier is applied. In the fourth example, the assistant provides 22 minutes and the therapist provides 23 minutes of treatment. The total time spent is 45 minutes or 3 units. Bill 1 unit of therapeutic exercise with the CQ modifier. Bill 1 unit without the assistant modifier with 8 minutes remaining. Apply the 8-minute rule to the third and final unit of 97110 to bill without the CQ assistant modifier because the therapist provided enough minutes, 8 or more minutes, without the assistant's minutes to bill the final unit. The rule changes when different services are provided. In this case, the assistant provides 11 minutes of 97535 and the therapist provides 11 minutes of 97530. Under the Medicare total time rule, this qualifies for 1 unit. If this was for private insurance, the AMA rule would apply and you could bill 2 units, 1 each. The de minimis standard does not apply when different services are provided. Under Medicare, you can choose to bill 1 unit of 97530 without the modifier or 1 unit of 97535 with the CO modifier. Both must be documented. Most untimed codes are going to be for evaluations or reevaluations, and only a therapist can provide an evaluation, so the modifiers would not apply anyway. Group therapy or 97150 is an untimed code. The assistant provides 10 minutes to the group, and the therapist provides an additional 10 minutes. 1 unit of 97150 is billed for each group member. Because the assistant provided 50% of the time, which is more than 10%, the CO modifier is applied to each claim. Thank you for viewing this presentation. If you found this video useful, please like the video and subscribe to our YouTube channel. And please visit us at www.therapycomplay.com. Thank you.